All right, I'm Jim Gentry. I'm cardiologist with Centennial Heart with specialization in advanced cardiac imaging. I met Diane about 5 or 6 years ago. I've been following her kind of each year. She was initially referred to me by one of her partners, Dr. Jones, who saw her for an abnormal heart rhythm, but also noted that she had what's called a bicuspid aortic valve. And so that valve has become more narrow over time, and that's why I've been following her closely. And it's progressed to the point where now her valve has gotten tight, where she's now getting short of breath, and now we're needing to think about getting that valve replaced.
The procedure itself is actually sort of the more easy part of it. Actually, the hardest part of the case is how do we get to where we got today? And a lot of that is a lot of time and effort spent in pre-procedural planning. We take a lot of time going through CT data, cath data, echo data, all of this data to really try to identify what the best option is for the patient. And then once we figure out what that actually is, then we come today and execute that plan. And so that's sort of our goal with each patient, is to really look and try to figure out what's the right option for each individual patient. My name's Andy Goodman. I'm an interventional cardiologist and specialize in structural heart interventions. Either later in the day when I round or the next morning when I round, that they really feel better even before they leave the hospital. Since this all the time, that number one is making that connection in the office and understanding exactly what their goals are, and then really tailoring our therapy and our treatment options to what their goal is, and along that way developing the trust that they believe in us to make the right decisions for them, and then to execute that plan when it comes to the day of the procedure. And so I think trust, and I also think faith in our program is really, really important. And that's just not only the doctors, but all of the nurses that work in our clinics, and all of our staff in the office that help that patient as they go through that valve journey. Because what we just did in the operating room was just a small snippet of that patient's journey throughout the whole process, and that patient will continue to follow up with us once they leave the hospital. And so I think from the very beginning, setting that trust and the ability to know that we're going to get them a wonderful outcome is really key.